Right. Hello, everybody. Welcome. Thank you for joining us for our third Project Firstline webinar today. If you have any difficulty today, please go ahead and drop anything you need inside the chat right here up to the side. And we have Alyssa Long, and she'll be able to help you out with any technical difficulties you might have. Sorry about that. It's the first one of the day, first time being on camera for the day. So stretching out the legs a little bit. All right, so today, okay. All right, so we're going to be exploring the body and the healthcare environment reservoirs and pathways for infection. How can healthcare workers minimize risks? Today we'll have Shay Drummond and myself as your felicitator / host. Next slide, please. All right, welcome. All right, just to give you quick heads up, some housekeeping. Please feel free to turn on your videos, mute your microphone. If you have any questions, please type those in the box. Please note that this session will be recorded for educational and quality improvement purposes. Next slide, please. All right, so what we have today is our agenda. We're going to be doing our welcome, our intros, training objectives, presentation and commentary, Q&A, breakout sessions, and summary reports. And then we'll wrap it up and close it out with a thank you. Next slide, please. All right, a little bit about NCUIH. So NCUIH is a national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public services for American Indian and Alaskan Natives living in urban areas. NCUIH is the only representative of the Title I or Title 41.5 under UIOs, under the IHS and the IHCIA. NCUIH strives to improve the health of over 70% of AI American Indian Alaskan Native populations that lives in urban areas supported by quality, accessible healthcare centers. NCUIH strives to create a broad awareness of Indian health issues while maintaining a visible presence in DC. We track legislation and provide congressional testimony as we distribute news, resource updates, and legislative alerts. We hold conferences, webinars, and host an interactive website that helps to disseminate information and felicitates partnerships. Next slide, please. All right, so we want to acknowledge, we would like to thank and acknowledge the Centers for Disease Control and Prevention for their continued support. Project Firstline is a national
Okay, we have lost your audio.
Sorry about that. I'm not sure what happened there. Okay. So the contents of this program do not necessarily represent the policies of HC accreditation body, OSHA, CDC, or HHS, and should not be considered an endorsement by the federal government. Okay, next slide, please. All right, just a quick little reminder that if you can complete the survey today, talking about our session, so that we can continue to improve our presentations. On your screen here, you'll see a QR code that will lead you to the survey. Feel free to scan it with your phone and complete it as we go through the session. It will be on the bottom left corner of every one of our slides. So anytime we're talking or we're presenting, just look in the bottom left corner and there you will see the QR code. So please take time and complete that for us so that way we know what we can improve on for the upcoming sessions. Next slide. Okay, so Alyssa just added also the link in the chat. So if you want to go ahead and click on that, you're more than welcome to if you don't want to take your phone out. All right, and then here we have, this is NCUIH's Project Firstline team. Everybody's featured there. Next, please. All right, and these are our trainers and felicitators. So we have Karen, myself, and Marie. Uh, Next slide, please. All right, so I'm going to do something a little fun, a little different, right? Just to stretch our legs out, or not our legs, but our minds. I do a lot of storytelling. My name is Kyle Mitchell. I am Diné. I'm your felicitator today.
So Health Center, this is Verity. How may I help you?
Oh, sorry about that. Zoom, right? We get used to those little things here and there. We just roll with it. All right, so I was thinking about a story to share, and I was thinking something more seasonal, something that we can think about just out there in the environment. And this story actually comes from the Cherokee Nation, and it talks about why or how plants are evergreen all the time. So in the very beginning, when time was new, when the first plants were being created and the first trees were being created, the creator told everybody, all of the plants, to stay awake for 7 days and 7 nights. As time went on, all the plants got together and they started thinking, it's all no problem at all. I can totally stay awake for 7 nights. No problem at all, right? Those of you who have run a long chain before, it's not as easy as it sounds. So everybody went to sleep the first night. First night was great. Everybody, well, they didn't go to sleep, sorry. Everybody stayed awake through the whole night. Nothing was going on. And then over the next few days, some plants started falling asleep here and there, here and there. By the time they got to the 5th day, a majority of them were asleep. And then by the 7th night, all of them were asleep except for a few trees, which were the cedar, the pine, the spruce, holly, lauren, and I think free. So those trees remained awake the whole time. And because they stayed awake for the whole time, the creator blessed them with keeping their greens throughout the year. So if you notice those trees I just named and you see them out when you're out and about, you'll notice that none of them ever lose their greens, that they maintain all of their leaves, which is why they are evergreen. Thank you. Hope you enjoyed that little story there. Next slide, please. All right, so we'll jump back into things. Our training objectives for today are to inform and educate healthcare workers on germ spread using body and healthcare environment reservoirs and share Project Firstline training resources. Number 2, explore how healthcare workers can minimize infection risks in the workplace. Next slide, please. All right, and to lead everybody through this, we brought in our guest lecturer, Shay Drummond. She is Project Firstline's infection control subject expert. Prior to joining the Firstline project, Shay was an infection preventice quality management consultant for the VA healthcare system and has frontline nursing experience in disease surveillance, outbreak response, and public health. Next slide, please. Thank you. Ladies and gentlemen, please welcome Shay Drummond.
Good morning or afternoon, depending on where you are joining from. I'm in Eugene, Oregon, and Kyle, I'm sitting in the midst of all sorts of lovely, beautiful evergreens here in Oregon. So thank you for sharing your story and kicking us off. Next slide. This morning, I have no financial disclosures, nor will I be discussing any products. Next slide. So our agenda today, it's great to be back for NCUIH webinar number 3. Today, we're going to continue our exploration of the body and environmental reservoirs and how to relate them to your workday and the tasks that you do, how to recognize the risk and pathways for germs to spread, and the actions that you can take to interrupt and stop those infections from occurring. Next slide. Reservoirs. So first, germs need a place to live. We call these places reservoirs. Essentially, they're like the home for the germ or their habitat. Reservoirs can be in the body, they can be on your skin, they can be in your digestive system or gut, they can be in the lungs and the airway and the blood. Reservoirs can also be in the environment. So think about water and surfaces that have water on them, dry surfaces such as countertops and bed rails, dirt and dust, and devices. Next slide. Recognizing risk. We deal with risks every day at work. Think about mopping up a spill, or you're checking a medicine dose, or maybe you see a wobbly patient that's about to fall. You're seeing that possible problem about to happen and you act. It's just a natural, normal, almost reflex response. So we can use the same process to prevent infections from occurring. If you learn to spot these opportunities for germs to spread, then you can step in, take the action, and stop the infection. Let's go to the next slide and discuss the pathways and the elements of how the germs spread. Germs need that pathway. Basically, and typically, they can't move on their own, at least not very far. So germs need a way to get from where they live to another place or a person. So how do they move about? They can get from place to place when they're breathed in, by touch, or through splashes and sprays. Germs also have to have a person to infect. So that person we often think about as the patient, but it can also be you. It could be one of your colleagues. It could be someone in your family or even community. Germs also need to get around the body's natural defenses to make a person sick. So an example of that would be someone that maybe is elderly or immunocompromised. Many of the things we do day to day in our healthcare can actually create new pathways. So think about routine healthcare procedures, such as starting an IV, surgery, a colonoscopy, and those aerosolizing procedures. Those break down and go around the body's normal defenses. People with healthy immune systems can fight that infection, but for some of our most vulnerable patients that we're treating who are already sick and struggling to regain their health, those germs can be even a bigger threat. Finally, germs actually need to survive while they spread to make someone sick. So as we're going through this discussion today, and especially as you're working in your breakout groups, keep in mind that germs spread and infections can be prevented. Acting on any one or more of these 5 elements can keep germs from spreading and keep people from getting infected. That's infection control. Now that we've talked about how germs spread and can potentially make people sick, let's take a closer look at the reservoirs and talk how they usually happen in healthcare. Next slide. Infection control actions, any of these points can keep germs from spreading and causing infection. So let's think about where germs live, which reservoirs are reservoirs you're dealing with, and how those germs might get somewhere else. Next slide. We're going to do a quick review of the body reservoirs to tee up some ideas from your breakout room activities to follow. We'll go to the next slide, which is the skin. So lots of germs grow on our healthy skin, and germs on skin can actually get on surfaces, other people, and things that will touch other people. Skin, especially our hands, carry many germs and spread them easily. So when our hands touch surfaces, we can spread those germs from the surfaces, not only to other persons and people, but to other surfaces and devices. Think about healthcare tasks that you use that involve touch in your hands. So again, putting in an IV, drawing blood, surgery, or trauma. All of these involve breaking the skin, which can cause that pathway into the body by bypassing or breaking down the body's defenses. Some of the germs that you may encounter that do live on the skin are Staphylococcus, so think about MRSA, Streptococcus, Candida, which is fungal, and that includes C. auris. So what can we do for infection control actions with skin? Hand hygiene. I know we talk about it all the time, but for all of the reservoirs, whether it's body or environmental that we're going to discuss today, hand hygiene is our #1 intervention that we can do to prevent the spread. What else can you do to help? Each of us can individually and together create a culture of positive support within our health environment with our staff on infection control actions. While that sounds like an easy task, it can sometimes be hard, but think about it as easy as maybe giving reminders to others to clean their hands, or reaching out to your infection preventionist or your infection control team and asking how you can help to support the facility's infection control hand hygiene program. And we can all mentor our staff and educate patients and let everyone know that it is okay to speak up and ask your provider to clean their hands. Another way we can bring hand hygiene to the forefront is using these materials and the opportunity to orient and train all employees, as well as your volunteers and contractors, on why hand hygiene is required and is also used as a broad infection control action. Other things you will want to do is make sure that you appropriately use gloves and do source control for skin by covering open cuts and wounds. Next slide. Respiratory. Okay, I know you all are very fatigued with all things respiratory, and I'm certain that everyone on the webinar can share great examples of how you are evolving your infection control practices and meeting the ever-changing guidance that we've encountered with COVID. Some of the other germs that live in the respiratory system besides SARS-CoV-2 to be aware of are Pseudomonas, Staphylococcus aureus, again, think MRSA, and viruses like influenza. When our infected persons, could be ourselves or our patients or coworkers, when they breathe or sneeze or cough, they actually are producing respiratory droplets that could spread germs. Germs are more likely to spread in places with poor ventilation and lots of people. Tasks involving the respiratory system actually can be as simple as brushing your teeth, cleaning or working with a CPAP machine that a patient or resident may use for sleep apnea, intubation, giving nebulizer medications. Infection control actions to reduce risk include the use of personal protective equipment. So that would be your respirators, eye protection, and following your facility guidance for PPE use. Also source control, so masking, keeping that respiratory droplets from making its way out to another person. Cleaning and disinfection is very important. And ventilation. Ventilation is a topic that we learned a lot about during COVID. And this is an area that I encourage everyone to become building aware. Find out what the air exchanges are in the various areas of your healthcare facility. Take time to have a conversation or meet your facilities engineer or building manager and learn about the space that you work in. If you have a dedicated infection preventionist, they can also be a liaison for this conversation as well. The science behind ventilation is evolving so rapidly, and I guarantee that science and our lived experiences through COVID will ultimately drive changes in our guidance. Let's move on to the next slide. We're going to cover blood. So if you notice in the chat, there are links for the infographics, and these are Project Firstline materials that everyone can access and use for training, for print them out, put them up in your areas, or for huddles. So when you think about blood, what is the first thing that comes to your mind? If you want to put something in the chat, feel free to chat. If you're thinking standard precautions, you're absolutely correct. We must work under the assumption that blood can become infected. Viruses such as HIV, hepatitis B, hepatitis C can spread in healthcare when contaminated blood is on a sharp item. If that item then would cause a break in someone's skin and create that pathway and spread to that person, it can cause an infection. We want to make sure we're not reusing needles and syringes. That is extremely risky. We want to be mindful of all blood in the environment, such as linens and devices, which can grow bacteria and spread then via touch or in the use of those devices. So standard precautions is a great, everyone should know, everyone should review infection control action that we all can do every day to reduce the risk of spread of blood and germs. So let's move to the next slide, the gut. We spent a lot of time on the gut last time talking about C. diff, and you know that it's filled with bacteria and some yeast, which are all necessary in a part of a healthy immune system. And most germs in our guts don't cause problems, but if they get out of the gut, they can potentially cause those infections when they spread. Germs in the stool can spread on our hands and skin when changing a diaper or helping someone with toileting, or back to the laundry and linens, changing them out and doing daily room care. Germs that can be lurking in our gut are the C. diff, which we spent a lot of bit of time talking about last webinar, E. coli, and Klebsiella. Again, you want to be mindful of your personal protective equipment that you're using, so appropriate gloves and gowns, and cleaning and disinfection. So for all these reservoirs, you really want to focus in and make sure that your disinfectants are EPA and facility approved, as well as following your facility guidelines and the instructions for use. So the IFUs, you'll see that there's usually in your facility guidelines that mirror the instructions for use for whatever device it is that you're cleaning. Each of these are different, so you'll want to make sure it's the right cleaning and disinfectant for the product you're using, and it has the right length of dwell time to kill those organisms. Now we're going to jump into the environmental reservoirs. Next slide. As you all know, germs are everywhere, including on surfaces and things in healthcare and the environment. Next slide. Common reservoirs in our healthcare environment include water and wet surfaces, dry surfaces, dirt and dust, and devices. Next slide. Tap water is usually safe to drink, but it's not sterile. It always has germs in it. That's why when we're doing procedures in our healthcare facilities, we have special sterile water that we use for our IVs and injections. So most of the time, the germs in tap water aren't a problem for healthy people, but they can cause illness in patients with very weak immune systems. And they can also carry germs that can be spread on surfaces. If medical instruments and equipment such as devices get wet, then that bacteria can grow. When those devices then get used, the bacteria on those devices then have that pathway to get into the patient's body or blood and cause infection. So think about the pathway of touches and splashes and sprays when you think about water and wet surfaces. Germs that you might hear about would be Acinetobacter, Serratia, Pseudomonas, and Legionella. These tasks that you may encounter them would be toileting, cleaning, whirlpool tub therapy, and hand washing. Again, back to our infection control actions, what would you do? Cleaning and disinfection according to those IFUs, proper device sterilization. So again, follow facility protocols and use of your PPE. On to the dry surfaces. Next slide. All righty, so those germs that we find on our bodies, in the air, and in the stool can often be also found on the dry surfaces. I know we also always have to have sort of one ick factor in this, the thought about stool just sort of floating around and landing on the dry surfaces, but it's important to keep this in mind because it often can be found on our high touch surfaces. That includes our keyboards and cell phones. Many of the germs that live on dry surfaces can live for a very long time. Some are days, weeks, and as we discussed on C. diff, it can actually be months. So pathway for the germs are touch. So anything we can pick up on our hands, we can spread from surfaces, we can move that around to people and other surfaces and those devices that we ultimately use on our patients or insert into our patients. Cleaning and disinfection is paramount for all surfaces. Again, device sterilization. So working with your sterile processing services on how instruments are cleaned, how instruments are stored and used. Dirt and dust. Let's move on to the next slide. So germs live in dirt and soil, and some of the germs you might encounter are Aspergillus or it's a hard one to say, Cryptococcus, that can live in the dirt and can cause very serious illness. Where this comes to play in our healthcare facilities is building construction, which can send germs and dirt into the environment. So be familiar with your infection control risk assessment project for all types of construction. This would include smaller construction and maintenance projects inside the building, like taking out parts of the wall or removing ceiling tiles or renovating rooms, or even if there's a water leak or sewage backup. These are things that you can help infection control teams in your organizations by being the eyes and ears. If you see these things happening, say something, speak up. Slide 18, next slide. Devices. We use so many devices every day in our healthcare, and something as simple as a pulse oximeter used on a patient's body can be the source of germs and create that pathway for them to spread from one patient to another or from a caregiver to that patient. So anytime we're doing any type of work with a device, such as an IV insertion or central line, catheters, endoscopy, be mindful and envision those germs that could potentially get on that device and how you can prevent that. Germs would be Staphylococcus, Streptococcus, E. coli. So think about all the gut bacteria that can get onto these devices and cause potential infection. Cleaning and disinfection is, again, one of our best resources and actions that we can take to prevent this. Other actions you can take are be familiar with your infection rates for your facility and reduce and find out what they're doing to reduce or maintain their healthcare associated infections. So get involved. All right, let's wrap this up and move on to the next slide. Here you have it. These are all the body and environmental reservoirs that you're now going to use in your interactive breakout room activity. Let's go to the next slide for our final takeaways that you can use. We are so focused on germs and the germ spread in healthcare, but why? The risk for germs to spread is greater than anywhere else. It's greater in healthcare because we're caring for sick patients that are already compromised and ill and may have weak immune systems. Sometimes we are the opportunities for germs to spread as we interact with many people during our day, but we also have the knowledge and capabilities to stop that spread. Next slide. These are Project Firstline links. And I know we've covered a lot today, but there's still so much to learn. So you can explore these links on your own and use them, whether it's for your own use, your teams, and orientation for new employees or staff. And I encourage you to hook into our social media. That's where you'll see real-time updates, new products that we're rolling out, and we really welcome your feedback. We want to know what works. We, more importantly, want to know what's not working with our Project Firstline materials, and we want to know what you would like in the future for additional materials. Next slide. Finally, okay, any questions for me before you move into your breakout room? I'll be standing by and visiting the breakout rooms via chat if you need an IPC friend as you work through your scenarios. It's always a pleasure to present our information, and good luck out in your breakout rooms.
Right. Thank you, Shay, for that presentation. Again, if you have any questions, please feel free to drop those into the chat. All right, next slide, please. All right, so now what we're going to do is have some commentary. We have two speakers here, Zoe and Marie. I will let them go ahead and introduce themselves briefly and then start on their commentary. So Zoe and Marie, it's all yours.
Anikisa, Nataswi Zoe Harris, Nutamas Masipia, Natai, Chicago. Good morning, everyone, or afternoon, wherever you are. My name is Zoe Harris. I am a citizen of the Mashpee Wampanoag tribe, and I currently live in Chicago.
Hey, Mitakyapia relatives. My name is Marie Zephyr, and I'm a proud member of the Oglala Sioux tribe, and I currently reside in Rapid City, South Dakota. Today, Zoe and I are going to go over a short commentary and just kind of discuss some of the historical perspectives of the infectious disease. So Zoe, as going to ask you, when you think about infectious disease from an Indigenous perspective, what comes to mind?
Honestly, I think about the really long history that Native people have had with infectious disease from first contact until now. Within my own tribal community, as far back as the early 1600s, we were affected by infectious disease, specifically yellow fever, and it decimated more than half our population at the time. And across Indian country, you can really see examples throughout history, whether that's smallpox in the 1700s or in the modern day with high rates of tuberculosis, hepatitis C, and COVID-19 in our communities.
Definitely. And how do you think that impacts healthcare workers and Native organizations like UIOs?
I think that history really serves as a constant reminder to respect yourself and others. Our communities have always been very communal, so we're constantly sharing information with one another so that everybody understands it. And I think that's very easily seen in UIOs. We want to make the information about infectious disease as informative and accessible as possible, so anybody on the staff can be informed, whether that's front desk staff or the custodian or a nurse practitioner. Everyone really needs to be aware of these practices.
I agree 100%. Zoe, thank you for your commentary. And now I'm going to go ahead and pass it back to Kyle.
All right. Thank you very much, Marie and Zoe, for giving that insight to our UIOs with an Indigenous perspective. We appreciate that. Next slide, please. All right. We are going to start our breakout rooms here. Let's see. So the activity we're going to cover is work together to create scenarios where you assigned body reservoirs interact with various healthcare environments. All right. So one body reservoir per room. This will be 15 minutes. And it as follows. So Karen will lead the skin. Alyssa will lead the gut. Sophie will lead the respiratory, and Zoe will lead the blood. All right, so please go ahead and join the breakouts, and we will jump in there and then we'll reconvene once we are done. All right.
For folks remaining in the main room, or comms person will continue to play the podcast recording if you are in the middle of something and are not able to join the breakout rooms. Thank you.
Yes, thank you, Diane, for that. Sorry. Okay, for these breakout rooms, you'll have 15 minutes. You want to work together to create scenarios that are given to you. The 4 rooms, you'll either choose one or you'll be assigned one, just as Diane said. For those of you who are away from the computer, might not be able to respond so quick, our IT will connect you with that. All right, please have everyone share their thoughts, okay? Summarize your notes and then return to the main room, and then we will share those out and discuss. All right, have fun with this exercise. It's made to be fun and interactive. So we will see you in there and we will reconvene. Thank you all.